Antiviral agents, which are drugs for non-HIV viral infections. All right, so antiviral therapy. There's not that many antiviral medications out there. A lot of these, like respiratory infections, bronchitis, ear infections, many of them are viruses. There's also other viruses, though, such as the herpes virus, chickenpox virus, which is basically the same thing. You develop chickenpox as a child, and it lays dormant in your spinal cord area, and it can come out as herpes zoster shingles later in life. Now, these are those of you, most of you, I bet, probably got the chickenpox vaccine, though, so that puts you at a lower risk for developing shingles later in life. So anyways, we'll talk about antiviral therapy. It's our ability to treat viral infections. It's limited. It's difficult to suppress viral replication without doing significant harm to the host. So it's just something that viruses are just a lot more stubborn than killing bacteria. And, you know, viruses are newer to us than bacteria that we've discovered years ago. All right, so here's one of them called Acyclovir Zovirax is the brand name. It is generic. It's been out for a long time. It's active only against the herpes virus family, so it's good for herpes simplex. So that's HSV. There's HSV 1 and 2. HSV 1 has always been commonly known as oral herpes, and HSV 2 is genital herpes. But again, now you'll see people with HSV 2 in the mouth and HSV 1 in the genital area because there's oral sex, so they can be transmitted either way. Varicella zoster, that's shingles. That's your varicella zoster virus. That's what acyclovir is given for, these types of infections. So the herpes virus develops resistance to acyclovir. We still give acyclovir, but there's Valacyclovir that's out now, which is called Valtrex. So there is some resistance to acyclovir, although I have not seen it too much in our area. So what happens is it's a matter of cost, although the Valtrex is cheaper than it used to be, but acyclovir still works pretty well for HSV1 and HSV2, the herpes vaccines, or the herpes virus. How are you going to give it? There's all different ways to give it, as far as it's given orally for these types of things, and if you're going to give the acyclovir, it's about 3 to 4 times a day that you're going to give it. Okay, so if you do give it IV, which you will do in the hospital, obviously, not an outpatient, you have to watch for phlebitis, watch the kidneys, and neurotoxicity also. Oral therapy, some GI side effects, sometimes some vertigo. Usually people tolerate it pretty well taking it orally. There is some acyclovir cream that you can put on cold sores, and you can feel like a stinging sensation when you put that on. This is the Valacyclovir, which is used more commonly. It's a prodrug form of acyclovir. It's for shingles, genital herpes, cold sores, and chickenpox. So it's also used for thrombotic thrombocytopenic purpura, hemolytic uremic syndrome, CTP-HUS. It's very rare. I don't expect you to know that. But Valacyclovir for the shingles, genital herpes, cold sore, and chickenpox. It's given, it's 1,000 milligrams twice a day for 7 days. For the shingles, for shingles, and also for genital herpes, although sometimes genital herpes you have to be on more of a prophylactically long-term, depending on how many outbreaks that the patient would have. And herpes labialis, that is of the lips, so cold sores, and there's like a loading dose where you could take 1,000 milligrams twice in 1 day and be done when you feel a cold sore coming on. So there's different variations of dosing for this. There's also famciclovir, which is a prodrug, again, to treat the herpes zoster, genital herpes. I have not prescribed this. It's just not as commonly prescribed as the other two are. The topical drugs also for herpes labialis, which is the cold sores, are the penciclovir, docosanol. So there's a Breva that you can get over the counter, and also there's the Denavir. But you can do the Zostavax too. Zostavax, boy, I'm thinking there is another form, which I don't know where it went. But anyways, there's an oral form also. Oh, Zovirax, that's what's called, Zovirax for the cold sores. Also, you can get ocular herpes, and which I've never diagnosed, never had to use, but these are the topical drugs. So just so you know that there's some antiviral topical drugs for optical herpes. Cytomegalovirus is an infection. It is a member of the herpes virus group. It's transmitted by body fluids. So most of us, or a lot of us, harbor the virus. You would be able to know by a blood test. So many of us don't even know we have it. 50 to 80% of Americans age 40 or older harbor the virus. It can remain dormant for life and never come out. But if it does come out as CMV, you have flu-like symptoms and just feel sick, they draw some blood because you can't figure out what the heck is going on with you. They find out you have CMV, which it's with antibodies, IgG or IgM. So if it's IgM, you have an active form of it, and then they can possibly treat you with that. There's ganciclovir, which I've never used. It's a synthetic antiviral agent used for herpes simplex viruses. CMV can be used with HIV, so it's probably why I haven't seen it, because I don't really deal with HIV infection. You can have some serious side effects with these issues with your white blood cells and your platelets, it looks like. Reproductive toxicity, nausea, fever, rash, anemia, liver dysfunction, confusion. So looks like these have a lot of side effects to it. This one here is another prodrug. It's used for the cytomegalovirus. Again, when you're going to see CMV come out, usually you will see it more with HIV patients, AIDS patients, because they're immunosuppressed. It looks like this can give as oral form, but causes a lot of blood dyscrasias again. So it's probably why it's not really prescribed, and we don't see it too much. This is another one which is used with CMV retinitis in patients with AIDS who have failed on the other ones. So these are more like HIV, AIDS drugs, people that are coming out with these herpes viruses, cytomegalovirus from that. This is another one that's used with AIDS. Again, you don't have to memorize these, but just know that they are out there. There's some drugs for hepatitis. There's different types of hepatitis. There's A, B, C, D, E, and G. There's also some subtypes, but the most commonly are A, B, and C. B, C, and D are the only ones that cause chronic hepatitis. There's no cure for B and D, but there is a cure for C now. Type A is the one that is the acute hepatitis from eating contaminated food. The Hepatitis C virus, there's 6 genotypes, there's more than 50 subtypes, so there's quite a bit out there. Sometimes you don't have symptoms and not know, and then eventually just need a blood test or your liver enzymes go up, and then they find it from there. So it is the leading reason, though, for liver transplantation. So they found out that hepatitis C is actually have more complications, higher incidence of liver failure than hepatitis B. It's through exchange of blood. Not sure about the sexual transmission. There's some controversy over that. Okay, so interferon family. There's alpha, beta, gamma. It's used to treat hepatitis. It's only given IV, but there's some adverse effects to it, including some flu-like symptoms. And I'm not going to read off the list below, but it can cause these symptoms. Ribavirin is another one that is commonly given. It's used in combination with an interferon. for treatment of chronic hepatitis C. There's a cure for that now, so there's other medications that are out there too. But these really know that it can cause birth defects, so it is a category X. There's some protease inhibitors. That's another class. These are the two medications that can be used for treatment of chronic hepatitis C. It's also used with other antiviral drugs to enhance the antiviral effects. That's the one thing with these antivirals, they can be used together to enhance the effects. Drawbacks, all these drugs are very expensive, and they can have a lot of drug interactions and adverse effects to it. Hepatitis B, we know 1.4 million people, and probably around a little bit more now, have chronic hepatitis B, which can end up in with liver failure. So you can get that muscle pain, jaundice, extreme fatigue. Chronic infection develops in a small amount of infected adults, but when you think about 1.4 million people, 5% is quite a bit. Cirrhosis, liver failure, liver cancer, and ultimately death. It is transmitted via blood and semen. I do know that it is 1 in 200 will contract hepatitis B, compared to HIV, which is like 1 in 1,000, just to give you an idea of how easily hepatitis B is contracted. These are the drugs listed to treat hepatitis B. Again, just kind of get an idea of that these are antivirals, as well as like interferon that is given to help treat hepatitis B. There's really no cure for it, but if you can treat it and suppress it, then that's good. Now on to influenza, which I'm sure you know about influenzas. We have the flu shot that's given every year. It is a serious respiratory infection. There's multiple strains of flu, with a few that are more serious that can cause mortality. These are all caused by viruses. There's different types. There's type A and type B. Just to give you an idea, and type A is more infectious than B. We see type A a little bit more than B, although some seasons we've seen a lot of B. So vaccination is primary prevention is what we're trying to accomplish. And what we do is we take the viruses, or I don't, but they take the viruses from the year before and they develop this flu vaccination with antibodies. They're not live viruses, so I know you've heard many people probably say you get the flu from it. You don't get the flu from it. You may get side effects of flu-like symptoms from it. Doesn't mean you have the flu or you're sick with that. The vaccines, again, they come out every year by the CDC, the FDA, and the World Health Organization. So there's two types. There's an inactivated. There is a live, but we're really not giving that anymore. So it's the high-dose flu vaccine that we're given. Protection begins about 1 to 2 weeks after vaccine. It lasts about 6 months or longer. So you'll see advertisements where the flu shot will come out in like August, and they'll say, come get your flu shot. Well, it's really best to wait as long as you can, because you know it's lasting 6 months. And sometimes flu seasons can go well into March, April, and May. So if you can get yours in October or November, that's the best time to get it. There is a very small risk for Guillain-Barré syndrome, which is a neurologic issue. You can become paralyzed, can't breathe, that kind of thing. It's really rare, but it can happen. There's 9 influenza vaccines on the market. Well, this is from 2016. There's probably more out on the market now. Every year it changes, though, as far as indications, who's to get it, etc. There are some precautions. So if your patients have fevers, you don't want to give it until they're feeling better. You can give it, though, with some minor illnesses. Egg allergy, you don't even have to worry about that anymore. So this is from the textbook. You have to remember, when a textbook's published, you have to give it about at least a year or two of being behind on things. So I do know that you don't have to worry about egg allergy anymore, because that's the thimerosal, and they don't have thimerosal in it anymore. So who should be vaccinated? Anybody that's compromised. Kids. Basically everybody now, they're saying, should be vaccinated, but more so you have to watch for elderly for sure. children. They say we should, especially healthcare providers, because we're around those sick people. Who should not be vaccinated? You should really be careful, like with transplants. That's when you defer to, you know, their specific specialty physician for that. So I don't mess with that kind of thing. But anybody who's immunocompromised should have it. Like if you have MS, they should have the flu shot. And then I already talked about when they should be administered. Now, what happens if you get the flu? So there's Tamiflu, Relenza, which really we don't give too much. It's the Tamiflu that we're given. Not even the Symetril or Flumidine, so they could be probably resistant at this point. Tamiflu is what's given, but just to remember that Tamiflu has a lot of side effects, so some people can get confused with it, just not feel well, and it only really reduces the flu symptoms by about 24 hours. When you're sick with the flu, you'll take the 24 hours. Sometimes weighing the risks and the benefits, you just choose not to take it. Also, you have to catch it for it to work the best within 72 hours of the onset of the flu. Remember, it's by nasal swab. You have to take the swab and go way up in the nostril, although there's some new swabs out now where you only go in the proximal part of the, or distal part of the nostril area, which is good. There's RSV virus that children can get, which they can do some inhaled ribavirin. Also the Synagis, it's a monoclonal antibody for preventing RSV infection in newborns. So I'm not sure how often they give that, but it's out there. And that's it for antiviral agents.